Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 353,097 confirmed cases of COVID-19 in Canada and 109,361 cases in Ontario. Chatham-Kent has 486 cases and Sarnia-Lambton has reported 405 cases. Michigan has 324,779 cases, with 19,263 cases being in Detroit. Today, we are reporting 51 new cases of COVID-19 in Windsor and Essex County. Of the 51 new cases, 22 are close contacts of confirmed cases. 3 are travel-related, 6 are community-acquired, 2 are agri-farm workers, 2 are local healthcare providers, and 16 are still being investigated by our staff. We have had 3,507 cases since March. 3,075 cases are now resolved, and 354 cases are active and being followed by our health unit. 14 people are currently in the hospital and 2 people are in ICU. Our community has lost 78 people to COVID. 54 deaths have occurred among residents in long-term care and retirement homes. There are currently 4 long-term care and retirement homes experiencing a COVID-19 outbreak. And there are currently 7 workplaces in outbreak. 1 in a healthcare workplace, 1 in manufacturing, 1 in the finance sector, and 3 are in the agricultural sector, and 1 is at place of worship. 2 schools are currently in an outbreak, and there are 2 community outbreaks as well. Testing for COVID-19 is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor has 2 assessment centers. We're at Windsor Regional Hospital, Olette Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wichu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. I know I sound like a broken record, but I still want to remind everyone that we are in the middle of a pandemic that is affecting each and everyone in the world. The regulations, the restrictions are constantly evolving to protect the community and reduce the spread of COVID-19. One of the key aspects of managing a pandemic is risk communication and ensuring that everyone is aware of the risks and restrictions that are in place. In an effort to provide more clarity, we looked at our local masking order, the municipal bylaws on masking, and the provincial order on masking. We came to the conclusion that under the provincial regulation, Ontario Regulation 364/20, and the local section order on face covering is no longer necessary. Section 22 order allows medical officers of health to take immediate actions to reduce the health risk to a community, but since the municipal bylaws and provincial regulations already cover what is in the face covering order from the local health unit, and in fact, the provincial regulations are more restrictive in nature. We will be updating our website later today, but please note that rescinding the order is to provide more clarity on the local restriction for people to follow, and it's not a reflection of any change in the risk on how viruses spreads in the community. Physical distancing combined with the facial covering and reduced number of close contact is still the most effective measure to reduce the spread of COVID-19 in the region. I'll now switch to our weekly epi summary. So very quickly, this is what we will cover. I want to touch on some of the previous data elements that we were using because it's been a while that we have talked about the full picture of what's happening in the community. So looking internationally very quickly to see what's happening around the world and among some of the selected developed countries, you can see Canada continues to have do better than many of the other countries that are also experiencing a huge second wave in the world. More importantly, in this particular graph, the key to note is France was in a really bad shape a couple of weeks ago before they put in some of these restrictions. And the moment they put the restrictions, their daily case numbers have gone down significantly. That's represented in the green line. So important aspects of some of these measures of restrictions, even though as difficult it sounds, but those measures work, and those numbers, it helps to bring down the number. And many of the regions and many of the countries in Europe are also in some sort of a restriction and a lockdown phase, but still seeing large number of cases. In Canada, we are still seeing this pandemic handling with the case counts that is much better in many of the comparable countries. Looking at the cumulative confirmed cases, similar picture, US continues to lead with the number of cases in the country, and Canada by far still has the lowest number of cases per million population among many of these countries that are identified here. Looking at the death rates per million population, and this looks at the 7-day average, daily average, and we can see Canada still is below, our death rates is still below compared to many of the other countries, but it is increasing, and something that we have to be mindful of, especially as we are dealing with the second wave. The overall cumulative confirmed COVID-19 deaths per million, still same picture. Some of the countries have experienced a significant number of deaths. In Canada, we're still on a holding pattern, but that number we can see from the flattening that we have noticed between July, August, it's picking up and the number is increasing. Now focusing on the local data, this is what the current Epi data looks like, and as we can see, the number of cases that we are reporting every day is increasing at a rapid rate, and much to the worst aspects of the pandemic that we have seen in the first wave. Focusing just on September to today, or yesterday when the last data was updated, we can see that we had a pretty good run in the month of September with low number of cases. We started to see some occasional spikes in the month of October, and then starting November, things really started to change with our daily cases that we are reporting now is coming close to more than 40 on an average every day. Even we reported 51 cases today as well. So this graph shows the 3-day moving average, which is again similar to what we're seeing, a continued ongoing trend of increase in the number of cases. From a 7-day moving average perspective, we have seen a huge spike more recently, as you can appreciate in the last few days, last few weeks, and we basically surpassed the worst that we have seen even with the first wave, when we had many farms that were in outbreak. But right now we are dealing with the cases that are spread across many sectors, including our schools, long-term care home, workplaces, as well as many community cases that we are seeing throughout the region. Overall, looking at the cumulative case and deaths of COVID-19 in Windsor-Essex, as you can see more recently in the last month or so, now the graph is showing us a steep increase in the number of cases, which is a concern, and as a result, we'll continue to see ongoing cases in our community. The slide captures the week-over-week incidence rate per 100,000 population from week 18th to our current week. We have seen number of peaks and valleys throughout the pandemic, and we have seen some relatively stable number in the between week 32 all the way up to even week 42. But then now after week 42, week 44 and onwards, we are seeing more cases every day, and as a result, our week-over-week rate is increasing. Overall, the week 48 is still ongoing, and it will end on Sunday with the number of cases that we added today, and over the weekend we can expect that it will be similar to what we have seen on week 47. Comparing our weekly COVID-19 case rates with the southwestern region as well as the province. So obviously overall the provincial case rate continues to be higher than Windsor-Essex, but compared to the southwestern region, we are way above their average at this time. So this figure looks at all the tests and unique individuals that was tested by week in Windsor-Essex. In total, 137,153 tests were completed as of November 14th. And for the week ending on November 14th, our percent positivity was 2.9%. More recent data using our percent positivity is close to 4%. Last week, approximately, the assessment center and the lab has processed 4,511 tests. Looking at percent positivity based on the 7-day rolling average, this is what it looks like compared to many of the other regions in the province, and we are pretty much in the high range right after Peel, Toronto, York, Halton, and Durham region, and as I mentioned, our more recent estimate is coming close to 4%. This graph looks at the percentage of test results that are available within 1 day and 2 days of someone getting tested, and approximately 42% of tests are being processed with the results available within 1 day of being tested. Within 2 days of being tested, 83% of tests are being processed with the results available. So our lab turnaround time is definitely is improved a lot, and it's helping us to do better case and contact management. Looking at the regional and provincial rates overall, right from the beginning of this pandemic to now, what we can see is Windsor-Essex still had the 4th highest rates of COVID cases in the province, and we had the highest case rate back in the summer, but now some of the other regions have more cases than us. But with the cases that are increasing at a rapid rate in our community, we definitely are at a risk of getting worse very quickly. Looking at rate per 100,000 by municipality, and again, this is a cumulative picture of what we are seeing. What we are looking at is Leamington and Kingsville, which we already know because of large number of farm workers. They still lead the highest case rates, and understandably then Windsor being a highly populated area compared to the rest of the municipalities, which are relatively similar to each other with respect to the cumulative cases. So just focusing on the case rate per 100,000 by municipality starting from November 1 to present, we still see the highest case rates are coming from Leamington, followed by Kingsville and Windsor, while the rest of the municipalities are relatively similar and close to each other, when Amherstburg reports being the lowest case rates per 100,000 by municipality starting November to today. Looking at the age and sex distribution, the pattern continues to be the same, with most of these cases between the ages of 20 to 40. What we have seen in the last 2 weeks is a change in the distribution pattern, with most of these cases happening between the ages of 0 to 19, and a lot of those are linked to the school outbreak, but something that that is a concern that we really want to address to make sure that we are not putting our children at risk of contracting COVID. Zooming it further with respect to October to present, and so from October onwards, when in the greens, we no change in the overall picture, but what we can see is in the last 2 weeks, and compared to overall, the pattern still is between the 0 to 19 age range is 19%, while the 20 to 29 range is 21%. So looking at the distribution of cases by municipality, this graph shows the overall picture of what each of the municipality has seen throughout this pandemic, with the majority of cases being in Windsor, 40%, followed by Leamington, 30%, and Kingsville, 19%, while the rest of the municipalities are close to 2 to 3% of overall cases. Just in the last 30 days, Windsor continues to have close to 62%, and while the rest of the municipalities are relatively stable, except for Leamington, with 16% of the overall cases. Zooming further on the last 7 days, almost 3/4 of the cases are from Windsor, followed by Leamington and Kingsville, while the rest of the municipalities are relatively at a low rate. So these figures look at the percentage of cases that cannot be linked to a previous case using a 7-day average. Currently, approximately 20% of our cases cannot be linked to a source of exposure, signaling community transmission. And we have seen that the community transmission go up and down, but right now, because of the large number of cases and as a result of outbreaks, all of these cases are linked generally, and the proportion of these cases that are not linked is still 20%. With the rise in cases, we are seeing cases acquired in many different settings, and this can be brought through either household contacts or a close contact, or that are cases that are tied to an outbreak in various settings, as well as travel-related cases. So this particular graph basically gives you a better picture of distribution of cases every day. And again, I would just remind some of the question that we generally receive about the cases under investigation. So every time when those investigations are completed and we are able to classify these cases under certain categories, all that information is posted in this type of graphs and also on our website. So as we can see more recently, what we are seeing is the household contacts and the outbreak related cases that are continue to be the highest proportion of the cases that we are seeing every day. But we continue to see travel-related cases, and we continue to see community cases. So travel-related cases, and again, I would like to remind people that the border is closed and open only for essential travel. Please be responsible in how you're using it. This is not an excuse for people to go just because they can. They have to remember that we are still in the middle of the pandemic. There are good reasons to put all these travel restrictions in place, and while there is many hardship that can be caused by closing the border completely, it is our responsibility to take that responsibility seriously and follow the guidelines that are put forward to ensure that you are keeping yourself safe, and you're keeping your family safe, and you're keeping your community safe. Looking at percentages of exposure, starting from October to present, most of these cases that we are seeing is a result of the household contact. And essentially that means that a single person bringing in a case in the family and everyone else is impacted by it. And while many would be okay and will recover from this virus, but if in your household, if you have someone with a chronic condition, if you have someone your mother, your grandmother, or your grandparents, if they are seniors and if they have any underlying condition, they could be at a much higher risk of developing complications. So household contact, what we are noticing is almost in most of these cases, anyone bringing in potentially infecting everyone else in the family. And then we continue to see cases that are a result of outbreak, and then community transmission is still at 22%, and the travel, as I reminded, that travel continues to be a concern, and we really need to pay attention to what we are doing when we are traveling and isolating when we are back in Canada. So looking at the active outbreaks that we have, and if you recall, October 8th, we didn't have any outbreak. We had 0 outbreak in the community. And how quickly that has changed now to reflect that now we have 14 outbreaks that are currently being followed by the health unit. Looking at the hospitalization and ICU for COVID-19, and as we can see that the overall 7-day average for hospitalization ICU is on the rise, giving a signal for pressures in the healthcare system. Focusing more on the September to present, we can see that we had a fairly good run in the month of September with respect to COVID cases, but starting November, things starts to get worse. COVID-19 hospitalization in Windsor-Essex. This is just focusing on the COVID-related hospitalization, and this looks at the overall acute care capacity. As we can see that we're touching the 90% capacity, and we know that with COVID cases increasing and in the community, there are more pressures to the hospital. They have to isolate individuals, they have to test them, they have to make sure that they are putting all those systems in place. So it's not only about the capacity, it's about the workload that they have to see to isolate that. So even though it may show as 90%, but overall from the real physical space, they may have less physical space because of the isolation requirements for many individuals. Similar picture in adult critical care capacity, as we can see that we are coming close to 80% of the capacity in the ICU beds, which is a concern. The adult vented critical care capacity continues to go up and down, but it's at close to 25%. Current outcomes, as we can see that because of the recent surge in the number of cases, there are many active cases in the community that are currently self-isolating, and that's why you can see that the number has increased to 8.4%, and majority of the cases are resolved in our region, but unfortunately we lost 2.3% of our population to COVID. Looking at the age and sex breakdown of COVID-19 deaths in the region, similar picture, not much changes. Majority of these people who died are between the 80 years and older, and then all the way up to 70 to 79 and 60 to 69 year. Looking at our overall case fatality rate, we continue to do better than the provincial average, and overall, when we are comparing the long-term care home versus the overall picture of Ontario and the Windsor-Essex, our case fatality rate is below in all these indicators. Looking at our case doubling time, we can see that our case doubling rate is coming close to the provincial average as well as the national average. Focusing on just starting September, we had a pretty good run with our case doubling time, which was high. That means it's a good sign that we are doing better than the province and the government of Canada. But more recently, our numbers are pretty much similar to what the provincial and the national doubling rate is. Looking at our median R effective rate, and it's the most recent estimated median R effective is 1.36, and as we've talked about in the previous time, when the R effective is more than 1, that means there's ongoing transmission that's happening. If the R naught is less than 1, that means the transmission is reducing in the community. We have seen lots of ups and downs in the median R effective rate, but it continues to be at 1.36, indicating that the transmission is increasing in the community. So overall, in summary, we are well into our second wave. It came to us very quick, and the numbers of cases increased rapidly. We've got a number of outbreaks that are happening throughout the region. We have a number of restrictions that are currently in place, and we really need to be careful in how all of these cases will result in the mortality and morbidity in our region. The cases that are currently acquired is distribution between household contacts, close contacts, and outbreaks, and that's why we have seen many outbreaks, and I mentioned 14 outbreaks in total in the region at this time, and majority of the cases that are being distributed across is household contacts and close contacts. That's why the social gatherings and all these closer gatherings are a concern. COVID-19 related hospitalization has increased recently, and our day-to-day doubling time has now come close to the provincial and the national average, and our effective is at 1.36, indicating that the viral activity continues to increase in our community, with more cases to expect in the next few days or so. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
I guess just that number that you said about the 22% that cannot be linked to a previous case, linked to community transmission, how concerning is that number? Have you compared it to like the first wave or anything like that? Like, what does that number tell us?
So the number tells us that what's the proportion of cases that could be out in the community without anyone knowing, and that's why we cannot really pinpoint that how the transmission is happening. Obviously, if that number increases, it means that there are more cases out there in the community who we are not aware of, neither themselves not aware of, and they continue to spread the disease. So we like to keep that number low every time when we are seeing that cases, if we can link them either with an outbreak, whether we either through close contact or household contacts, it's much easier because then we exactly know that where the spread is happening so that we can put all those control measures in place and contain as best as we can. But with this increase in the community transmission, it would be, it is a concern. So at this time, it's at 22%. And again, it's just the function of proportion. But if you really look at the number, if you're reporting 50 cases, 20% is still amount to 10 cases a day that we cannot identify. That means there may be at least 10 or 15 other that are out in the community that we don't know and who else they're infecting. And unless we pick them up, they will continue to spread.
And what about the hospitalization rates currently? Are they, would you say they're higher or lower than what we saw during the first wave of the pandemic?
So if overall, when you compare the first wave versus the second wave, what is different is in the first wave, the hospitals were were working at a reduced capacity. So even if in one of the graphs that I mentioned about the acute care capacity, if you look at the data from May, they were operating between 50 and 60% of the capacity to preserve or anticipate any surge in the community if results from COVID. And then they were asked gradually to increase their services because of timely action from public health. The hospital didn't see that surge. So they had that capacity to start offering the elective surgeries and resuming many of their operations. So it would be hard to compare in terms of what we were seeing, but right now, definitely, if the cases continue to increase, we will be put in that difficult situation to ask whether we should cut down some of these non-essential surgeries and everything that's happening right now at the hospital. And I guess nobody wants that. So we will like to keep the hospitals free from COVID as much as possible. We'd like to reduce the spread in the community, and we like to keep that number down.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Dr. Ahmed. We anticipate the Premier will announce whether or not we stay in orange, stay or move to red. Have you had any conversations yet with the province? You mentioned that you would be presenting qualitative information to them.
Yes, we do that regularly with our province, and we do share all those details. We talk about all the outbreaks that we are seeing in the community. We talk about the status of these outbreaks, whether they are in the containment or whether they continue to pose many challenges. So we did had all those conversations. We shared all the number, and we anticipate that the province will take all of our information into consideration and make a decision later today.
I know you never want to speak for the province, it is ultimately their decision, but do you think that our region should have more restrictions to keep the spread down than it already does have?
Well, I think the province have to look at the data and the numbers, and I think the good thing about this framework is there are some quantitative indicator that helps everyone understand rather than someone thinking that, oh, what's going on? Why we are going into a more restrictive phase? So the numbers do help, and the numbers right now for Windsor-Essex, it doesn't look good.
Then separately, we've learned that a local religious group plans to travel to Toronto this weekend to join a protest against lockdown restrictions there. Can you comment on that? You've spoken before that you suggest people avoid any travel. So what do you think about a group joining a protest in a municipality that's under lockdown right now?
So I think there's a provincial guidelines already in place that people from the low transmission rate should not travel to areas of high transmission. It definitely puts our entire community at risk, even though our case counts are increasing at a rapid rate as well. But adding more cases knowingly or putting ourselves knowingly at risk, I think this is not something that we want in our community. And I'm sure that people who are thinking about it, that they consider that and in the best interest of our community, and also in the best interest of their own families and friends and close people that live with them. It puts them at an increased risk of contracting and increased risk of spreading. And God forbid if something happens as a result, it would be really unfortunate.
Thank you.
Any questions from AIM 800?
Hi, good morning. I'm just wondering, I don't want to confuse people with what you were mentioning earlier, Dr. Ahmed, about the mask. And so I just want to be clear that you are rescinding your health unit order in favor of just following the provincial regulations as it relates to face covering?
Yes, that is correct, because I addressed that issue a couple of days ago when people are thinking, well, my order talks about the religious exemption. The provincial order doesn't talk about religious exemption. So which order I am following? And obviously, in terms of clarity, we clarified that the more restrictive order always takes place. And in our situation, because whatever is in our order, it's already covered in the provincial order. So there's nothing that our order is adding. So that's why we felt that it's important that from a clarity perspective, that we take that away with the message that it doesn't mean that we don't think that it shouldn't be in place. It's already in place by the province, so we are just rescinding that particular order. There are other orders that are also in place, more specifically on the agri-farm sector, which will continue to be in place until we see something more strict from either from the province or from the federal government to keep our agri-farm workers as best as possible, like safe as best as possible.
So other than the example that you just gave, are there any other examples under the provincial face covering orders that you can give that are more restrictive than what we previously had locally that people will now be required to follow under the provincial order?
Yes, so our order was on the retail stores, on the businesses. The provincial order goes all the way into the office settings as well. So the provincial order is enforced at our health unit, as well as all the businesses that are operating, whether they serve clients or not. They're also under the order to use face covering within their office settings.
So will health unit, the bylaw officers or with the city, will they all still be able to lay the charges or levy the fines under this now that it's not specifically local to Windsor-Essex, it's provincial?
Well, the municipal bylaws, the police always had the powers to enforce everything that was under the Reopening Ontario Act. Also, to my understanding, they also had the ability to enforce whatever is in our Section 22 order because of the original emergency order that was issued by the Premier. So there is always that flexibility and to use that. What we have worked in the beginning of the pandemic is our team worked closely with all our municipal partners, our law enforcement agencies, to clarify some of these roles and responsibility in terms of who's doing what. instead of duplicating all the work. So that worked so far, but not to confuse that our officers probably have the least ability to enforce many of these restrictions. If I am issuing an order, obviously they are able to enforce that restrictions easily. But most of the provincial restrictions, they are enforced much easily by the bylaw officers and by the police. So I don't want to confuse that
Okay.
It would change anything. I think they always had the ability and they still have the ability.
Okay, thank you so much.
Any questions from CBC?
Yes, good morning. I'm wondering if there's any Bagley School update on that investigation and the transmission.
Case counts. Just the case counts,
Oh.
maybe I can mention that.
I can give you just an update on the case count. So we do have 40 cases in students and 9 in staff at Bagley, and we continue to do our investigation. So not sure if there's anything further, but we are continuing to work with the school boards and on this outbreak.
Sorry, it was cutting out quite a bit there. Can you just repeat the numbers? And then I think you said you're continuing to investigate.
Yes, so we have 40 cases in students and 9 in staff related to that outbreak at Bagley School. And we continue to work with this school and the school boards on this outbreak.
Okay, thank you. And we're hearing of some local snowbirds here, so people who are typically go south or head south to Florida for the winter. Some people are still choosing to do that in our region, and they're kind of finding ways around that land border closure. Should people be doing this, and what are your thoughts on, traveling into the States, staying there for a few months, and then coming back here during all of this?
Well, I think what I will say is and I would request our federal government to be very, monitor these activities very closely and restrict all non-essential travels. We are in Windsor-Essex is probably at the highest risk of everything that's happening in the US, and I showed you the data from the United States as well. Michigan has the case count, which is close to or more than, I forgot the exact numbers, but it's as high as the entire country of Canada. So Michigan and then Canada, case counts are similar. So the risk, what you would anticipate while you are here, is much higher if you are on the other side of the border. So use that opportunity very carefully when the border is there for essential travel. And most of the essential workers, we do have lots of healthcare workers who are supporting the Michigan healthcare system. Not for their personal reasons, not for their personal benefit, but to support the health system there. So we expect them to continue, but definitely I think it would be a mistake for people to go to the other side and using these excuses to do whatever. So I think we really have to be careful, and I really hope that the federal government will be looking at those travelers and making sure that we're keeping our borders tightly controlled to prevent any importation of cases in Canada.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
AMA 100?
No, thanks. Have a great weekend.
CBC?
Yes, I know you've kind of talked about this already this past week, but what has really been the strain, I guess, on contact tracing resources within the health unit at this time? I know there's still a lot under investigation and cases continue to rise.
So the strain is the increase in numbers and the ability to reach cases within 24 hours and all contacts within 24 hours to 48 hours. So based even on the case count of today, 51 cases, when we're looking at, I would say approximately 40 nursing staff that are dealing with these cases, it's quite a heavy workload. And so right now we have reached out to the ministry for resources and support that they offer, and we are having the ability to have another field epi join us for about a month. We are getting 6 case managers and 11 contact investigators as well that will be assisting our staff. And we are looking at a new schedule to give staff a little bit of relief, but still, dealing with the demands of all of the cases and the contacts, not to mention all the work that is required for outbreaks. And we have other departments helping with outbreaks and the school follow-up, but it's the interviews with the cases can take, an hour or more, and, documentation and follow-up and contact. So people that are, cases, while they're waiting to hear from us, they could make a list of all their close contacts, because that will be a question, and then that becomes their next priority to contact the contacts.
So how many additional people are you looking to bring on to help out?
So with the ministry support, it will be about 16 people, and also the field epi for a short term. And we are looking on hiring some more COVID managers. We call them COVID managers because they'll follow a group of nurses, and with this schedule we're proposing. So a few people to help deal with the cases.
And what does the team look like in total right now, just numbers-wise? You said 40 nurses. Is that who is doing all the contact tracing at this time?
So we have about, I would say maybe 24 nurses that are on our case and contact team, and we also have 20 school nurses who are helping with case and contact management and dealing with the school outbreaks and the cases in the schools. So even though we have 2 outbreaks in schools, we have other schools that have cases. So that all requires follow-up. So those nurses also help us. And then we have an outbreak team, which is our environmental health department, and they have dedicated public health inspectors, nurses, and health promotion specialists to help with the outbreaks that are occurring. And I'm trying to think if and our epi team as well. Like I said, they're keeping track of all of the numbers and the information that's needed to manage the outbreaks. So the addition of the support of a field epidemiologist from the ministry will help in the short term to get a better handle on the outbreaks.
Okay, thank you.
Thank you, everyone.
Thank you.